course, we know that repeated sun exposure puts someone at a higher risk. Someone who works out in the sun or who repeatedly has been exposed to sun tanning or laying out. Also, 80% of those who have oral cancer have been exposed to some type of tobacco, either smoking or smokeless. 70% of people with oral cancer have had exposure to alcohol. About twice as many men are seen with oral cancer in comparison to women. And the average age of diagnosing oral cancer is usually around the age of 62. It's important to know that family history does put you at a higher risk for oral cancer. It has also been shown that 25% of people with oral cancer have not been exposed to excessive smoking or drinking. There are certain genetic conditions that put you at risk for oral cancer. And some studies have shown that there is an increased percentage of people with oral cancer who also have HPV. Alright, we're going to talk a little bit about oral cancers. The definition of oral cancer is the cancer occurring between the vermilion border of the lips and the junction of the hard and soft palates or the posterior third of the tongue. There are many different types of oral cancer. They are all listed here, and we will go over them in greater detail and show some pictures following this section. So, first of all, what we want to talk about is the squamous cell carcinoma, SCCA. It's a malignant neoplasm of the stratified squamous epithelium. Alcohol, tobacco, and other irritants such as sun and some chemicals are all risk factors. They make up approximately 90% of all oral cancers. 40% occur on the floor of the mouth, 38% occur on the lip, and they are capable of metastasis. And here is that picture of the squamous cell. The next is the verrucous carcinoma, or snuff dipper's cancer. It makes up about 5% and usually looks like a cauliflower appearance. Here is a picture of that. You also have the minor salivary gland carcinomas. They develop obviously in the salivary glands which line the throat and the mouth. There are multiple types of this cancer. And here is a picture of that. You can see it outlined just along the tooth. There are also lymphomas, and these are both the Hodgkin and non-Hodgkin lymphomas. They develop in the lymph tissue. And here is a picture of that. And then you also have the odontogenic tumors, and there are many types of these. Many of them are seen in younger patients, so a lot of pediatric dentists will discover these. Here is a picture of an odontic tumor. You can usually see those on x-ray. You also have leukoplakia and erythroplakia. These are things seen usually pre-malignant and early invasive oral carcinomas. They are white or red patches on the gums, or here's an example of erythroplasia that you see on the tongue. Okay, so here I am at my sister's dental office, and she is going to show us how to do a quick oral exam to detect oral cancers. First of all, we're going to go ahead and feel the soft tissues under the angle of the mandible. We always check for symmetry and any masses or lumps. Also in the neck.
Then we're going to look at the mammalian border of the lip. Look for any lesions, discolorations. Going to look in the vestibule. And open. Going to check the buccal mucosa. And then open. Okay, and lift your tongue. So we're going to look under the tongue to the floor of the mouth. And then also, okay, stick your tongue out a little bit. We look at the tongue on both surfaces. And then you can hold it back in. And then also the floor and the tongue underneath the tongue on each side. And then bite together.